Hey there, it's Cindy. Here with my 2-week update. So I am doing, I think, really well. I have a lot more energy than I did a week ago. I had my first post-op visit. This one was with the physician's assistant who said everything looked really good. He also gave me some passive range of motion exercises to do 3 times a day for the next 4 weeks starting today. So my appointment was 2 days ago, and he wanted me to wait until 2 weeks from the surgery, which is today. I did those. That went pretty well. There's some soreness in the shoulder, of course, but nothing terrible, and I pushed myself a little bit, but I asked him, like, where's the boundary? Where should I, like, how much is too much? And he basically said, well, if I get tears coming to my eyes, it's too much. Well, okay, I can stay away from that for now. So, but anyway, so, so I did that. That's really good. As I mentioned, I've been walking every day for the last 3 days. Today I took a long walk. I didn't expect to be out as long, but I was out for about an hour, and that went really well. And I was actually kind of keeping my pace more or less during that time, probably a little slower than I normally do, but quite a bit faster than I did the other day. I was just kind of strolling the other day and got really tired toward the end and just took a nap when I got home. But, this is as it should be, so I'm still prioritizing rest. I'm often taking a couple naps a day. Haven't had one yet today. It's about 5 in the afternoon. But, the day is still young. I might kind of, run out of energy at some point and just need a little refresher. But so far, so good. So, is there anything else I want to tell you? Oh yeah, so I changed something in my pain management regimen, which was to move from using ibuprofen to naproxen sodium, Aleve. And I did it because I wanted to be able to reduce the number of times I had to take medication. And particularly, I don't want to have to get up in the middle of the night to take medication. So I have switched over. That's going well. I asked the PA about it, and he said they actually prefer that patients use naproxen sodium for that very reason. I wish that someone had told me about this, but again, they're not super forthcoming about these kinds of details. This is an area in which they can improve. My goal for myself is to get away from having to take Tylenol, which I'm still interleaving with the naproxen sodium. I'm going to try that out and see how that goes. Today was a more active day with the starting of the exercises and actually having more physical exercise. So I'm not backing off yet today, but I might start taking a little bit less tomorrow and see what happens. So anyway, that's it. I guess the long story short for me is I'm feeling grateful to be at the 2-week mark. I'm feeling good. I did learn that I can take this sling off and have it off while I'm watching television or working at my desk. I can also kind of rotate, that gives me the opportunity to kind of articulate my wrist and move my hand around, where I noticed this hand was getting a little bit stiff from not moving enough. And I'm still squeezing the little ball on the end of the sling when I have it on, which is good, but it's super nice to be able to move the hand around. So anyway, that's it for my update. I feel like I'm doing really well. So yeah, I will check in 4 weeks when I have another update from my doctor. All right, take care. See you soon. Bye.